Hello, I am Dr. Venkata, plastic surgeon. Let us discuss about chin implant surgery. How these chin implant surgeries are being popular and how they are being evolved technologically. Let me show you an example. See, normally you will have a jaw like that. This is the a model of a skull with the lower jaw. This is the lower jaw, this is the upper jaw. So in these proportions we will assess in the simulation images whether chin is adequately protruded or chin is retruded, whether it is adequate or not. Once we feel that chin is not adequate, let me show you how these are done. Now we will make a 3D printer of this jaw. This is the lower jaw. Now we are planning to put a implant here. So we will reproduce a 3D print of that particular patient's jaw done from a CT scan image. Now let us show you an example of this is a 3D print lower jaw, that is a mandible of an individual. This is made from that particular patient. Now we have reproduced this mandible outside his body by a material, so that we can study on this. How much extension, see this is a mandible implant, like a chin implant, which is forming the lower jaw. This is the chin part, okay. Now if you see carefully, this is there is a forward extension and also a little downward extension. That is how we can plan how much downward and forward extension is required, which is adding beauty to the face. So that this is what I am telling. This is a 3D print, thereby we can increase, decrease, we can do everything outside the operation theater before making a original implant, whichever is required to be fixed in that particular jaw. This is how we will plan a 3D print a jaw implant, and various materials used for this. Nowadays the peak is polyether ether ketone is one of the best organic material which we can make, and then it is fixed to the jaw. How do we fix this with the jaw? Let me show you another example. Similar one you can see it. This is another lower jaw reproduced with this again. This is the implant. See, this implant is bigger than the other one. So everybody will have a different jaw, everybody will have a different beauty measurements and then desires. If we want bigger one, this can be. We can't put sizes which we can't insert in the tissues. We have to plan accordingly and then insert it through the inside orally. By making a cut here, we'll fix it, and then we'll fix with the titanium screws which will stay permanently. And it can also be done from the lower part through from the neck by outside incision. This is how a 3D print a lower jaw or a chin implant is planned for aesthetic purpose of the lower face of an individual. Thank you.